Something on again facts and myths and how do we do and what we do. I need everyone's attention, and if you can keep interaction, it will be great. So this is a kind of summary lecture with what's right and what's wrong. So your 3 years male, it's great. Normal for history, development, normal for 24 months, first order 12 months, development period of 20 was slightly less, and 22 was like 24 months. From 24 months, his words disappeared, stopped responding to his name, reduced use of eye contact and gestures, less interest in surroundings, screamed frequently, and seems to be his own work. So, you're happy with the symptoms. So, clinical assessment was consistent with the diagnosis of autism. So, I think we just wanted to highlight the red flags. These are the crucial points we should not miss out, right? I do understand people may have hypoglycemia, and hypoglycemia has cerebral activity increases. Now I'm following all of them. So if you respond, I will move on. Otherwise, I will stay. Do you agree? Still no reply. Do you agree? Yes. Okay, then I'll move on. Some other questions which have been covered in the last 3 sessions, and I want perspective from you. There will be different aspects as well. First is this contagious? Can we eat in the same plate, or can we sit together for dinner or lunch? What's your answer? No. Does this mean my child is mad or mental? No. Is this psychiatric disease? No. Should my child go to normal school?
Yes.
Yes. So, mild to moderate, yes, normal school, or even moderate, normal school with the special support. So, special support is very much necessary. School is good, they will understand the issues and they will give some extra support as well. So, make sure that parents approach the school as well as you write down later. So, parents are helped by the school. Okay. Is autism curable? Sure. I heard in the newspaper yesterday so many articles, cure for autism, do this, do that, special medication I have, 5,000 rupees a week, it's cure. Not curable? Nobody is claiming, it's curable. Okay. So answer, yes, it's not curable, it's not curable. But yes, with the good family support, therapies, interventions, educational support, social support, that's very essential different aspects of support, and the holistic support. The mild or moderate group, they should manage their life with some difficulties, and that will be managed with some adjustments. Positive factors, who are the children? So primary autism, definitely a positive factor. So early diagnosis and intervention very much necessary. These children have better outcome. Better communication skills in the children. So child, if you have good those skills, better. And support from everywhere. Family must, education system, and surrounding society. So if you do that, you have better outcome. Okay. Can he live normal life? Same question again. Yes. Yes. So most answer is yes, but sometimes.
Yes. No, it works. You can't come this side. No. It works, Nitish. Just don't come too
Same boundary.
Yeah, it cuts off over.
Okay. But first I also ask a question. What is normal life? Having Boeings and budgets and 9,000 crore of debt, is that normal? Or having farming and sleeping in the afternoon and relaxing, is that normal? Or what we are doing is normal? So first and foremost, it's objective. There is nothing normal as a definition. And as long as someone is happy, self-sufficient, independent, enjoying the situation and participation in the activities which most people want to do, I think that's normal life. And this, everyone should be able to do that, including autistic child. So he should live normal life in a way. So again, there's nothing like normal, that's what I feel. And what we are doing, they can do it. And these famous people, they have autism at some level, and they are all very famous people, right? So it's not that this child cannot do it. Okay, special diet? No. So healthy diet, balanced diet is a special diet, nothing special. So that's what we do. Healthy balanced diet is required. Elevation diet only in celiac disease. So people who have celiac disease do it, otherwise not anymore. As mentioned, avoid high sugars, high chocolates or caffeine, artificial colors and flavors and these substances. These causes this hyperness. So avoid those things. So chocolates, sugars, and I'm not saying avoid as a total avoidance, but give moderation in the daytime, but not in the night time. Problem with the diet is selected diet by the child. He doesn't eat balanced diet. So make sure diet is balanced. We discuss high doses vitamins, antioxidants, vitamin A, this, that. Usually it doesn't work unless the child is deficient. So yes, diet is supplement required only if child is on selected diet and deficient, like say, iron deficiency, fruits and fibers, associated diseases, etc. But the problem is, as everyone say, why not to try XYZ medication or vitamins or something? Because it may not have side effects and it may help in case. So perhaps one of the trials says it's okay, but it should not be focused as a therapy. You give this medication and you will be cured. Can specific exercise help? Yes or no?
Yes.
No. Yes. No, I think specific exercise does help, helps the concentration. And most of therapists who are here, we have seen, if they have rough and tumble play, jumping, trampoline, swimming, or even rolling, they have a blood career. And if they want to ask them to do anything, they have more concentration. Advanced energy, sensory stimulation, the way it works does help. Swimming definitely helps. Physical exercise like jumping and things does calm the child. And PADS, other way of communication. So they communicate very well with the PADS. That's something to think on as well. Hyperbaric oxygen or oxygen therapy?
No.
It does help, but it helps only to the person who is with the business. So if I am in the business of therapy, it helps me, but not to autistic, right? So it's again no. While we are going through smooth stream, how the diagnosis is made? We discussed, it's not the easy diagnosis. You may have, and what we want is we should have that visual perception, that pattern recognition. You see something and realize this is going towards that. But it doesn't mean you are diagnosed autism. So you have to have suspicion, pattern recognition is very much helpful, and we should follow that, and then follow the child. Then it requires some different investigations or observation by different people, a team, and then diagnosis is made. And that just doesn't include something as some MCHET or anything, but it's also observing different areas, by different people, different strengths of the child, different weaknesses of the child. So we can use the strength of that child into weakness. And what Saurabh was mentioning, that networks. The temporal network, the short network is not that well formed in children with autism. So speech, communication are the issue. So verbal part is difficult. But the long tracks, the frontal occipital part, those are well formed. So they have very good visual skills. They remember things once seen. So always focus and use that strength, visual skills in something that can be used up. And different examples are there. But as a team is required. One in isolation should not just diagnose it because I feel or MCHET says it's autism, so it is autism. I think you have proper diagnosis. Because once a diagnosis is made, it remains for whole life. And diagnosis should include strengths and weaknesses as well as child. Why the blank? Okay. Diagnosis is difficult. We agree. Management child is more difficult. And you have to have teamwork for that. Should have a holistic approach, just not one thing, just not medications or therapy, but it's a combination of different things. And very important question, who is the best therapist? Therapists are sitting here, but still say, parents are the best therapists and parents are the best teachers. You train parents, you teach parents, you know and explain why things are happening, what should be done, how it should be done. And if they are doing that well, you got the answer. So parents must be trained, must be shown, and they are the best therapists and best teachers. This has been covered, but again very helpful and very much needed. Autism, age and epilepsy. Is age immersed in each and every child with autism? If you say, everyone says no, my business will start closing down from tomorrow. No, I totally agree. No unnecessary investigations including EEG. So child has epileptic seizures or you are suspecting endocrine syndrome or something, then yes, there are high chances of non-specific EEG abnormalities, but does not mean epilepsy. So no routine EEG needed, even no routine para needed. Sometimes what happens, child is clear autistic and we get the referral to para, then phone back, Well, why you want para? I want to assess the child, my team want to assess the child. It says child is not listening. And if you say para accepts, બાળક તો સાંભળે છે પણ એના ધ્યાનમાં હોય. So again, don't request para unnecessary. Instead of that, that 1,500 rupees of para can be used for full 5 years of full assessment. What we do is full 5 years of assessment with all the para-based training parents and teaching, and that is more helpful than 15 minutes para. That's what I feel. Should be on ADs, antibiotic drugs. Dr. Like I said, around 25% children may have epilepsy, so why not to start? No. Excellent. Thank you very much. I agree with you. No role of routine ADs, and it should be given on confirmed epilepsy. So then, because child is autistic, let's do EEG, let's start on medications, or even without doing EEG, let's start medications. So no routine ADs, no role of prophylactic ADs. In case 25% को chance है दे देते हैं, at least 25% को बच जाएंगे. No, don't do that. It's complex. We don't into that. Role of the other drugs which I already discussed, and few of them. First and foremost, there is no curative drugs. Unfortunately, there's lots of business going on, and the way it works, perhaps. But we should be clear to the parents, to the society. There's no curative drug. Yesterday, I was very sad to read the newspapers. You must have read as well. People will say, I have special medication. You come to me, I have cured these many patients of autism. But people come to me, after 2 years, all the autism are cured. No, it's not that. And when you ask, what's the medication? It's a special medication with special things. I will not tell you. Right? So don't begin that. And this medicine is sold very costly. 1,000, 2,000 rupees for a week. And parents will take that medication even if they can't afford it. Yes, they are required specific medications for comorbid conditions, as we discussed, for epilepsy, behavior, psychosis, other symptoms, to control those symptoms, have better quality of life. But don't overdrug them and make them dull and sleepy. So don't do that, right? Other medication, again, no current role, as discussed, secreting, chelation therapy, heavy metals. People try heavy metals. Again, no role of that. Mushrooms, some specific mushrooms from Europe are being imported, and if you take these mushrooms, things are cured, not. Ideal, again, no role. People want to try, but they should know what's happening. It shouldn't be the blind faith debate. If I spend 2 lakhs rupees, it's going to be cured. No. Most of them have placebo effects. Some have multidirectional effect. It's mainly placebo. And what everyone says, continue therapy, and you will see result in 2 years. And anyway, we know that if you do early intervention, early management, give proper therapy, child will be improving, right? So it's not the drug. So from tomorrow I may say this is special medicine, but give from this, I will not tell you what it is, but after 2 years, this autistic child will be better. And it will be better because of therapy, not because of this. But I can say this. So be aware of what we are doing and what we are supporting. Immune modulation has been discussed. Antifungal therapy, steroids have been tried, not useful. Basically, they should have all standard vaccination as scheduled. No immune modulation. Okay. This is what happens. We discuss a lot, and then someone will be sitting on the mobile and searching the internet, and suddenly comes the relative. And those questions starts at the end, which you again discussed. You know, I know it's a cure. I read in the newspaper. Some specific drugs are available. And now, the stem cell. Again, we discussed very clearly, there is no clear cure with autism, but it's under trial, no proven data yet, but it may be the future after 5-10 years, I don't know. Should we save umbilical cord for the next child? Again, answer is no, there is no role, because we can generate stem cells from child's own cells. So there is no need to spend at 70,000 or whatever, I don't know, but no need for that. And I think this is the last important few slides. What I feel philosophy should be. I'm not saying this is the right way, but this is what I feel. Because when there are no cures, when there are chronic conditions, frustrating situations, and we are looking for all possible resources, parents look for all possible resources, which may or may not work. And sometimes we want to try something in case or by chance if it works. There is always a hope, and yes, we should always keep hope open. And also family doctors and everyone wants to do something because they want something good for the patient or for the child. So they want to do something. And sometimes we feel pressurized. So, we should do something. And sometimes we are pressurized. But what should be our goal? First, know how. We should know what are side effects. If it's not working, what are the problems? First, know how. Keep the hope alive. Provide the family the best current available evidence. What's right, what's wrong. It's a professional guidance. And perhaps yes, leave the decision to the family that they know what should be done. If they want to go ahead, let them go ahead. But they should know what is right, what is wrong. And that's how the way it is. One should keep hope alive in realistic way and in the right direction. When we know a child has this and it can't happen, say clearly, in a positive way. And autism children need love and support from all, and that's what's very much required, integration and support from all. Thank you very much.